So just some quick updates. Just don't forget about our new webinar schedule. So the next webinar will actually be on September 20th. If you don't already, you can go ahead and receive the e-newsletters by following that link to the Children's Cabinet. Clayton will also put the link in the chat as well for you to be able to sign up for those newsletters. Today, we're really lucky to be joined by Byers and Meghan Cizek. They are going to be discussing their family first work, so achieving child and family well-being through primary prevention, the Kansas Family First Prevention Services. And then after that, we will go ahead and have any of the early childhood system updates. So I will go ahead and get us started with the presentation. I will turn it over to you, Meghan and Kaela.
Thanks, Erica. And good to see everyone. Many familiar faces here. But for those of you that don't know me, I'm Meghan Cizek. I'm with the Center for Public Partnerships at KU and have the pleasure of working with Dr. Kaela Byers from the School of Social Welfare on the Family First Prevention Services Act evaluation in Kansas. So we thought we would walk through just kind of briefly for those of you that are not familiar with Kansas Family First Services. We would just walk through briefly kind of what it is and where it's at. And then Kaela is going to get into, and Erica, you can go ahead to the third slide. We'll get into some of the outcomes and data and kind of where we're at in terms of the impact that these services are having in Kansas. So that's essentially kind of what our goal is today. We can also talk a little bit about opportunities for any of you to join some work that we are doing. We'd love to have new members join our advisory councils, which I'll share more about, and we're certainly available for whatever questions you have. So next slide. So what is Family First? So for those of you that aren't familiar, this is a federal law and related funding that was passed, I want to say, was that 2018? All right, I got it right. Kansas was actually one of 5 early adopter states. So we got started with Family First before most states, and it was a great opportunity for Kansas to receive an influx of funding. I believe the first set of funding was $13 million, and that allowed Kansas to get started in creating a stronger prevention continuum for families. And Family First is specific for the statute kind of reads that they have to be candidates for foster care. And so that is an assessment that's conducted by DCF to identify whether a family is in need of prevention services. And then they are referred to the organization that provides those. And we'll talk a little bit about those services here in a minute, but they can, states can receive reimbursement for services for a family receiving those services up to 12 months. And that is essentially one service. So if they need another service, they can be referred on to another service if that assists their family. States also, DCF, Kansas has a trauma-informed prevention plan, and they have to choose from a set of evidence-based services and a robust evaluation, which is what we'll talk more about. Next slide. So who does Family First serve? So as I mentioned, they have to be considered candidates for care, which essentially means that children are at imminent risk of removal into foster care, but can remain safely at home with additional services. The services may be for those children, they may be for the parents and caregivers. Pregnant and parenting youth are also eligible. And there's a variety of living situations, as you can see here, that they may be with their parent, but at risk. They're in a formal or informal kinship placement, but there's imminent risk of disruption and or aftercare services. And you can kind of see here that qualifying prevention services fall into four primary buckets of trauma-informed, evidence-based services provided by clinicians. So these four buckets are kind of how the federal guidelines organize the different evidence-based services. You want to go to the next slide? So this is obviously a map of Kansas and a map of kind of how those different services break down. And you can see there are 6 DCF regions across the 105 counties in Kansas. There are 36 DCF service centers, and then there are many privatized system contracts and grants for these services. And you can kind of see how it's organized here. This is actually a dated map. We had some shifts in services with a new grant fiscal year that started in July. But generally, this shows kind of how things are distributed across the different counties. And you can see that there are a very wide variety of services. So Kansas didn't choose kind of one singular approach. They chose many different approaches and really handed it over to the communities to say, like, what do you need in your community and what is going to serve families in your area best? And so it's kind of organized by the different providers and services there. Go to the next slide, Erica. Okay, so here's how it breaks down as of July 1st, and you can see the 4 primary service kind of domains I mentioned, and then there's another one. But essentially, you're kind of seeing how many different types of services were approved and funded by DCF across the state. And each of these has to be considered evidence-based, rated by a Title IV clearinghouse that the Administration of Children and Families has created. So they went through all of these different service models and said, okay, these are the ones we will reimburse for. And so we're, at this point, the states are limited to the federal funding being reimbursed for that. Kaela, do you want to add?
I did want to just jump in and say a couple of things. First of all, you can see that there are asterisks next to some of the programs and not next to others. That denotes whether or not they are reimbursable programs which are approved by the clearinghouse. So some of them have been already reviewed and approved. That's an ongoing process. So every so often the clearinghouse says these new programs are now available for delivery through Family First. So this is something that gets updated continually. Those that are not listed are things that were identified by the state through their sort of listening tour of communities and trying to understand what was needed. And they heard that this was a need. And even though it's not rated by the clearinghouse, so therefore not federally reimbursable, the state has made some investments in those programs where there was a local need. So even though they are not formally Family First programs, they're administered in Kansas through our Family First implementation, and the state supports those programs.
Thanks, Kaela. So here you can see kind of where the referrals are going by service type and where they're happening by region. So as of April 30th, and there are obviously more updated numbers coming, but this gives you kind of a flavor of the different services. So you're definitely seeing a considerable need for mental health services here and parent skill building. And then you're kind of seeing a breakdown across by region. It's not even, but it's definitely well distributed. So kind of thinking about how Family First fits in with kind of a larger continuum of prevention services and the needs across the state, you kind of see these 3 buckets where we really recognize the need to strengthen the service array. So you've got service silos. So there's this need to kind of think across sectors so that everyone thinks about child welfare outcomes as their responsibility. We all want to take ownership for that, because if we're going to invest in prevention services, that starts with early childhood. That starts with kind of those further upstream services that we know many of you all are providing through early childhood care and education services. There's also data gaps. So there's no real easy way to understand what's available and within and across communities and across sectors to support children and families. And it creates a lot of redundancies and gaps and confusion for families and providers. And then finally, the community voice. So we really needed to understand what's needed from the perspective of the community, including why available services are not currently being taken up, what needs to change within the system to make services more acceptable and accessible to families, and the need to meet community needs. So it must not just be informed, but driven by the community and their priorities and goals. Next slide. So part of our kind of solution to address some of those things is to develop an interagency and community advisory board. And this is also mandated by the Children's Bureau to have a kind of function to address systemic factors related to children and families service review. And with the early implementation of Family First, we created kind of combined the Kansas Strong project, which Kaela can talk a little bit about, but it is strengthening the service array and really kind of building on our prevention continuum with Family First, kind of across the child welfare system. So the objectives of the ICABs, we call them, are essentially to improve child welfare service array by increasing knowledge of service needs, gaps, and best practices, as you can see, to promote cross-system problem solving, CQI, action planning to address the system's gaps, and then to authentically center family and community participation. So this slide really kind of gets at the advisory structure. So the gist is, I'll just say, there are 6 ICABs and they represent the 6 different DCF regions. So we have 6 regional ICABs and then we have 1 statewide ICAB. And you can kind of see how they interact with each other and who is a part of those groups. And then we have the Family Council, which is our members across the state who are lived experts who really understand the child welfare or prevention services, whether it be from their personal experience as a child or youth, or as a parent, or caregiver, navigating and negotiating the challenges of the current system, and really help kind of provide that community and lived expert voice to the table. So this is, you can see it's bidirectional, it's all interconnected. The KU and DCF kind of representing the support and guidance for those groups. But these are really self-led groups that drive, what's needed, looking at data, analyzing the data, working through regional breakout groups that they identify the specific needs in their regions or in the community. So this is something that, if you're not aware of or you have interest in participating, really don't want people to feel like this is a child welfare specific group. This is really about child and family well-being and thinking about how we can bring kind of our different service perspective or personal perspective to the table in improving the child and family well-being outcomes for our state. So I'm going to pass this off to Kaela to kind of talk through the evaluation itself and share some outcomes.
Thanks, Megan. So we're really excited. We've been at this since about 2019, just briefly after the law passed, and we've been collecting data, working closely with all of the community agencies who are collecting information. Some of you I see here today, but who have been part of this work to understand to implement the programs that Megan has talked about, and then to collect the data so that we can understand individually and collectively how are these programs working to serve families and to improve their outcomes. So we have a number of outcomes that we're looking at to understand the impact of these programs. So in terms of short-term outcomes, we're looking at a few things. We want to understand timeliness. How timely are families once an identified need has surfaced? Are they getting, and a referral is made, are they getting engaged in services? We want all of those families to be, most of those families to be engaged within 2 days of that referral. We also want families, once engaged in these services, to successfully complete them. Generally, there's a service plan and a goal and something you're working towards. And so finishing those services to get the full impact of those services and in keeping families engaged over time. We are looking at child well-being. We want 90% of children to improve their well-being, but also parent functioning, 90% of parents to improve their functioning in parenting competency, in mental health areas, and also in areas of substance use where that is relevant. And then ultimately, and this is really the interest of the Children's Bureau and the implementers of, and that's OPRE and all the implementers of Family First, is keeping kids out of foster care, preventing that formal contact with the child welfare system, and keeping kids intact with their families at home, receiving the services they need to thrive. So ultimately, we're looking to keep 90% of children receiving Family First services maintained safely at home, and not removed into foster care, both during the time of their service and within that 1 year period from referral. Some of the services may last a full year, and so those things are the same. Some services are much more short term, but we track the families over the course of a year to make sure that that impact is sustained throughout the course of the time. So we'll first take a look at who's using Family First services. Meghan showed earlier in a slide, we have about 4,000 families who have received referrals to Family First, and that was as of April. As we mentioned, there's some changes with the fiscal year, so we have some more up-to-date data, but this is really recent data with the complete service array from last fiscal year, so that's why it's April data. But who's using these services? So here you can see the age range of the caregivers who are being served. And you may notice that it ranges from 16 to 80. And that's because Family First is a really inclusive, comprehensive service array, and it's intended to serve the whole family. So we have teen parents in this array all the way up to grandparents who may be either caring for their grandchildren or who are part of an extended family. So wide range of families, average age in the mid to upper 30s. Here you can see the annual income, and what's really striking about this is that there's a significant proportion of families who are living in poverty. We also have, so the majority of families are earning in the $0 to $15,000 category. So that's a quarter of families, and that's below the federal poverty level. So that's alarming. And then you can also see that our decline to answer is a high response. There's 20% of families who decline to answer, which typically means that that's a socially sensitive answer. So those could be additional families in poverty, or it could mean we're serving families across the spectrum. We don't really know what that means, but we know that there are a number of families who haven't reported, and then most of the families that we are serving are in the lower income category. When you look at education, what is striking here is that that we have quite a lot of education among our families. Most of our families have completed at least a high school diploma and beyond. We had a percentage who also declined, and a smaller percentage who could have some high school. And then here you can see that 45% of those served are employed full-time. What's important about that is that most of our families are either are employed full-time, part-time, or in school, yet still living in poverty. So that's telling us that families have jobs, but they're still not able to make ends meet to meet their needs for their families. So that gives you a little snapshot of who's receiving services and what some of those associated needs might be just based on demographics. I want to get now into talking a little bit about child permanency and then child and caregiver well-being. So first, I want to just take a look at the findings from our administrative data. So this includes all of the data around permanency, timeliness, and successful completion. As I mentioned, so each of those targets are listed here with their target. So our goal is 90% or 95% of cases in most of these. And the takeaway, I won't go through all of this for the sake of time. We'll share these slides so that you can peruse this at your leisure. But the key takeaway is that we are, for the most part, at or near our goal of 90% of families receiving family first services being diverted from foster care within the time frame of services and within those 12 months following the referral. Across the board, our substance use services, that's a little bit lower. We're at 81%. As many of you know, substance use issues are really complex, sometimes take quite a long time to resolve. And so, that's just a reality. That's a little harder metric to achieve in some cases. So that is an important takeaway. And then also another takeaway is our timely services. We are not meeting our goal. This is the closest we've been to meeting the goal throughout the life of the project. But part of that has to do with what is family engagement? What does that actually mean? All of our programs are reaching out to families in a timely way. We do know that anecdotally and through data, they're reaching out timely. But whether or not they're able to reach families and truly engage them within that tight time frame, that's a different story. So we're looking at some different ways to measure that so we can capture that story more successfully. And then, about half of cases across the board are closing successfully. We're losing cases for a variety of reasons, whether that be families disappear, they decide they don't want the service, the child is removed ultimately. There are a number of reasons why a family might not complete services, but at or more than half of those are successful in their completion. Next, I want to talk about our assessment data. So that's talking about child well-being and parent well-being. And I just want to make one distinction. So the data I shared just a moment ago, that is looking at all cases, all family first cases. Our assessment data is looking at all complete cases. So this is a subset of the full population. So I just want to be clear about that. The numbers of the sample are on these slides so you can see what the denominator is, but I just wanted to point that out. Okay, also these are initial findings. We continue to collect data and assess these over time. So one of the things we are assessing, as I mentioned, is child well-being. We collect 2 measures on child well-being, and the reason for that is child age. So one is the ages and stages questionnaire, social emotional. The other is the strength and difficulties questionnaire, and the difference in when they're used is simply age. So for the ages and stages questionnaire, we want to see lower scores. This is used for younger children. We want to see the scores decrease over time. If we go to the next slide, you can see, and this is a box plot, so this is showing you the mean and the spread of scores at time 1, which is at enrollment, and at time 2, which is at the end of services. And the line in the very middle is the mean. And you can see it's really small here, but you can see that this goes slightly up. This is the one exception to all of the rest of the findings. I'm giving you a spoiler right now. All of the findings are moving in the direction we hypothesized, and they are significant. This is wonderful news. This is the one metric that is not, and it's a data problem. So I want to put that out there. We are changing this, but sharing it in, in terms of full transparency. This isn't quite what we're hoping to see, but you can see we only have 391 cases that even have these scores. And like I said, it's a data collection issue that we're addressing. So you can see the spread of scores is going down. So that's showing like general improvement in the population, but this one's a little hard to interpret. So we'll go to the next one, and this is the strength and difficulties questionnaire. So this is the child well-being measure used with older youth. It focuses on strengths and difficulties in behaviors, emotions, relationships, and a lower score is what's desirable. So here you'll see, and I won't spend time here, but that mean score going down and the spread getting smaller from time 1 to time 2. That is statistically significant. So we're seeing improvement in child well-being for older youth who have received and completed their services. If you look at parenting, we look at a few different measures around parents. So the first one is the parenting sense of competence scale. This is intended to understand parents' own sense of their skills and confidence to solve problems and feel successful as a parent. We want to see higher scores indicating higher sense of competency over time. And here you can see those scores are going up. This is also statistically significant. There's about a 4-point change over time on that scale. If you look at mental health, this scale captures several different subscales. So this is the depression, anxiety, and stress scale. So we look at depression, we look at anxiety, and we look at stress. And we are looking for lower scores on all 3 of these subscales to indicate fewer symptoms. So depression, you can see the mean is going down. The scores are compressing into those lower levels. So that's a positive outcome. The next slide, you can see anxiety, the same story. And then the next slide, the same with stress. So stress, anxiety, and depression going down among caregivers who are participating in Family First services. And that is a significant finding. And then finally, substance use. We have 2 measures for substance use, one for alcohol, one for drug use. And these are only used among programs where substance use treatment is a goal of the service. So it's not all programs who are contributing data to this metric, but the first one is the Alcohol Use Disorders Identification Test. This is for risky and harmful alcohol use. We're looking for lower scores showing fewer risks, and we see that. It's also statistically significant. And then on the next one, the drug abuse screening test. For drug use, we also want to see lower scores over time from time 1 to time 2. And I'll mention also that these 2 substance use scales are used with the member of the family with the substance use issue. So while most of these are caregiver scales, sometimes it's the teenage youth who is completing these as well. And we're seeing still improvement in substance use behaviors and risks over time. So those are all of the outcomes that we're looking at really preliminarily. The takeaway is that everything is moving in the direction we expect, that we're seeing families improve over time, and those are significant. This is an ongoing process, and data quality and completeness is an ongoing issue. But the fact that we're able to see significant differences at this point means that that's a pretty strong difference we're seeing that we can detect even with those problems in the data. So I'm really optimistic about what this means for families and for our service array. So that's great news. Some limitations, just quickly, we don't have anything to compare it to. We set some goals around Family First and what we want to see our benchmarks. But is that better or worse than other things that are out there in the world? We're working on that. So we'll be able to report out later this fall some comparison of how is Family First, how do those outcomes compare to family preservation, compare to family services, so that we can understand, are some prevention approaches more impactful than others? As I mentioned, there's also issues with our data quality and completeness. You saw the map earlier. The services overlap. Families can get more than one service at once. That makes it pretty difficult to pull apart the impact of individual services. And so that's one of the reasons for our design. We are really wanting to understand, how does Family First in its entirety impact families in Kansas? That lets us look at that full array and understand, is it enough? Is it making a difference for these outcomes? The rural context of our state makes it really complicated. And then finally, these assessments all look wonderful, but there is a little bit of selection bias, both in terms of who accepts these services. Because it flows through DCF, there is some stigma. That's just a reality. We hear it anecdotally all the time about hesitation to engage in services because you must go through DCF to get that candidacy for care assessment. So people who are willing to accept both the service and the evaluation may be families with less level of risk. There may be something special or different about that group from the larger population. So we need to understand that. And that has to do with the acceptability of the referral pathway. Like I said, do families want to contact DCF to get the services they need? And that's it. That takes us to the conclusion, which I've already shared, which is that families are doing better. They're receiving services and they're faring better in terms of well-being as they complete those services. And we think that really provide some initial support for the continued investment in Family First Services, the continued assessment to understand in an ongoing way, are we meeting family needs? What other needs are there? And are families doing better as a result? But nearly 90% of families have avoided foster care involvement as a result, and are showing improvement in areas of well-being. So we're really thrilled with that. Questions?
So we have a question in the chat from Angela White. It says, so to clarify, referrals are only able to come through foster care / DCF. Can juvenile intake and assessment officers with community corrections refer?
Absolutely. So we said referrals go through DCF, but it's not for kids in care. It's for kids before they are in care. So if they are, if they're in juvenile intake, but they are not, if they're still in their parents' legal custody, not in the custody of DCF, they are absolutely eligible. When we say it goes through DCF, we mean the pathway to get a referral is through the protection and reporting hotline, and then they do an assessment and make that referral rather than doing an investigation. But these are services for kids not in foster care already. And I don't want to get too deep in the weeds because I don't want to get confusing here, but we do have a couple of those services that don't fit because we have these non-federal services. They don't quite fit the design of Family First, and those referrals can be handled a little bit differently on a case-by-case basis. So there are some nuances to some of the services, and I'm happy to answer individual questions. You can email me or something and I can answer those questions.
Any other questions for our presenters? Feel free to write them within the chat or come off mute and just say them out loud.
And Erica, I did drop our emails in the last slide. If anybody has any lingering questions or is interested in joining one of our ICABs in their region, we'd love to have you reach out and share that. I see many familiar faces, so many of you are already involved, but if not, we would love to have you join us. It's a great opportunity to connect with other providers in the prevention space and really help fill out that service array and help us identify challenges and solutions.
Alrighty, well, with that, like we said, even if you have a question that comes up as we go through our general updates, please put it in the chat or come off mute. And you are also more than welcome to email Meghan and Kaela for the ability to ask them individualized questions that you have. Thank you so much to you both for presenting today. Like Chad said in the chat, lots of good news. And so really thankful that you were able to come today and present to the group. From here, we will go ahead and do our generalized updates. So first, I would like to just let everyone know we've had something really exciting happen within the state. The Dolly Parton Imagination Library is now available statewide. And so no matter where a child is across the state, they are able to register for that. You can find out more from the link below, and Clayton is going to go ahead and pop the links to enroll in the chat. We actually, this coming Monday, there will be a celebration with the governor's office around the Dolly Parton's Imagination Library being statewide. So very exciting news and a really wonderful opportunity for your families if they are not already involved in the Dolly Parton Imagination Library. Next is that there are some upcoming ASQ training opportunities in August and in September. Those will be held or being put on by KSDE and KPERC, which is the Kansas Parents Information Resource Center. We will go ahead and drop into the chat the links to register for the first training that is actually tomorrow at 9 a.m. And then one on September 7th. So really great opportunity to get that training for those providers that utilize that developmental tool. As well as KSDE is going to be hosting a ASQ tips and questions session on August 11th, so this Friday, and then also on September 29th. And we will go ahead and drop the link for registration in that chat as well. Next is upcoming conferences. So the National Prenatal to 3 Research to Policy Summit is going to be October 12th from 1 to 2:30 Central Time. Registration is free, and that registration will go ahead and be put into the chat. State lawmakers, advocates, and really individuals from all over will be able to hear what states did the most to help children and their families thrive in 2023. Next is the 47th Annual Governor's Conference for Prevention, Child Abuse, and Neglect. That is going to be held in Wichita on October 18th through the 20th, and registration will open soon. We do have the link there to learn more about that conference. And then finally, the NAEYC annual conference is going to be held in Nashville, Tennessee on November 15th through the 18th. And we again will have the registration here and in the chat, as well as a link to learn more about that conference. Some general updates with early childhood resources. The Kindergarten in Kansas Family Booklet is available. Paper copies are available in English, Spanish, Vietnamese, Swahili, Arabic, and Burmese. We will have the link there for the online resource, as well as a link for you to request paper copies for your families even in any of those different languages. It talks about kindergarten readiness, kindergarten transition, and checklists for families and providers. In terms of professional development, are highlighting the Educational Center of Greenbush and opportunities that they may have. We have the Greenbush website on there. They have a wonderful array of professional development opportunities and encourage you to go ahead and look at those different resources. And then finally, we have some reminders and next steps. Our next early childhood recommendations panel will be Friday the 18th from 9 to 11:30 a.m. You can join all of these upcoming meetings on watch them on the Children's Cabinet YouTube channel. The next webinar the next iteration of this webinar will be September 20th from 12 to 1 p.m. And then finally, the next Children's Cabinet meeting will be Friday, October 6th from 9 a.m. to 12 p.m. So again, as I said beforehand, you can join all of those within the YouTube channel for the Children's Cabinet. And with that, I will say thank you. And please stay up to date through any of the social media and newsletters. And again, if you have any questions, please feel free to pop them in the chat. I do see a couple questions that I will go through. Are there enrollment limits for the ASQ training? I am unsure. What I would do is go ahead and go to the TASN website. That's the link that was popped into the chat. And I believe that it would let you know if enrollment has been, or if it's full. We had another question is, I guess this is probably for Meghan and Kaela. Do you know how many referrals to mental health may actually fit better in parenting skills? Or can you remind us of who decides label something either mental health versus parenting skills?
So we can't speak to that specifically in terms of like percentage of cases that may, but what I can say is that the way that the process works is when you call, the DCF contact does an assessment with the family to understand what their needs are, and then they make the referrals based on what they assess the needs are and the most appropriate service. So presumably they should be getting referred to the service that is what they need. Are there miscalculations in that? Sure, I'm certain that there are. One other thing that there was some confusion about early on and has been since corrected is whether or not families could get more than one service at once, and you can. And so there was like early on, people thought you could only get one, and so maybe they needed mental health and substance use services, or parent skill building and something else, and so they weren't getting all the referrals. Now there's understanding that you can get multiple, but we're still only seeing about 4% of referrals get multiple services, whether that reflects really just prioritizing need, one need, or still, not quite capturing all of that. We can't speak to that yet. We would like to do some additional qualitative work with families to understand that experience. We're doing focus groups right now with all the providers at each of the agencies to understand their process, but we also want to understand it from the DCF side and from the family perspective, so we can get at, is this the referral you needed? Did it meet your need and resolve the issue? We do know, let me backtrack on that just a smidge, which isn't related to the parent skill building versus mental health, but we did qualitative focus groups with those who are getting the kids to kin, kinship legal navigation service. And because of the nature of that, we are doing only qualitative. And what we heard from families is that it was impactful. It did resolve their need, and it's a need they wouldn't be able to resolve without that service. Meghan, anything I've missed that you want to add?
Great. I mean, the only other thing, I don't know if this is relevant or makes sense, but the programs are kind of determined also, like the evidence-based program itself is labeled, this is a mental health or this is a parenting skill, and they kind of put it in buckets at the clearinghouse level.
But many of those programs address multiple, like the substance use programs have a mental health component often. We have the Strengthening Families program is a new one this coming year, and it's technically a substance use program. It has evidence for substance use, but it's a parent-child group-based dyad program. So it has parenting, it has all of those things. So,
yep.
Thank you, Kaela and Meghan. I will also say that Chad put some information on the Kansas Prevention Conference in October in the chat. So thank you for that, Chad. And Casito has a conscious discipline 2-day workshop that is happening at the end of September. And that information was also put into the chat. So thank you, Caroline, for putting that in there. And I believe that is all of the questions that we have in the chat. If there is any other questions or thoughts, please feel free to email Kaela or Megan. And any of questions about the general updates, please feel free to reach out to the KU Children's Cabinet team. So thank you, everybody.